Hello everyone. Today we are going to learn yoga for vertigo. Vertigo is the sudden sensation of spinning in our head, and it is often triggered by the movement of head very quickly. There are two kinds of vertigo. First is peripheral vertigo and the second is central vertigo. Peripheral vertigo, let's understand it first. So we have three semicircular canals in our inner ear which is responsible for the balance in our body when we move our head, and anything wrong with those semicircular canals can result in peripheral vertigo, and this is the most common kind of vertigo. Now the second is central vertigo. So our brain, the back side of the brain, we have a brain part which is known as cerebellum. Cerebellum is responsible for the balance in our body when there is body movement like standing or walking, and it is even responsible for your posture. So anything wrong with the cerebellum can result in central vertigo. Now let's see the symptoms of vertigo. Number one symptom is disturbance in the balance of the body, which can result in fall. Second is the speech can become slurred. Third is hearing loss or ringing sensation in your ear. Fourth is difficulty in focusing your gaze. And number fifth is nausea and vomiting. And all these five symptoms can get aggravated if you are already stressed. Now yoga for the rescue. Yoga can help tremendously by first strengthening your cervical spine, which influences the balance centers of our brain, which is cerebellum and inner ear. It also helps in maintaining mind-body connection. Number three, regular practice of yoga can improve the muscle coordination in your body. Number fifth, it also helps in reduction of your stress level. Now let's start. Make sure you are sitting in a comfortable posture, your back straight and your shoulders relaxed. First, we are going to do a kriya, which is a yogic kriya. The name is Karnrandhar Dhoti, and there are 5 steps of this dhoti. You have to take two. The first is you have to take these 2 fingers, make sure your nails are cut, and if you want, you can lubricate it with some oil. Put your fingers inside your ear, not too much, just a little, and do 5 times rotating movement. That's it, 5 times. The next is pulling of your external ear or pinna. So hold your ear like that and pull it 5 times. That's it. Third is we have to squeeze our ear. So first finger will go up and the thumb down. Now squeeze 5 times. Mental focus has to be on your ear and the sensation which is happening there. This was the third step, and the last and the fourth step is massaging your ear. How these 2 fingers should be together and these 2 together. Keep your fingers like that, and up and down movement 5 times with slight pressure. That's it. This was 4 steps of Karnrandhar Dhoti. This is especially good for people who are having peripheral kind of vertigo, and it increases the blood circulation around here, giving you a lot of relief from the vertigo, and this can be done even during the acute episode of vertigo. Next, we are going to do Griva Sanchalan or neck exercises. They are also 4 in numbers, and this is especially good for central vertigo. How to do? The first Griva Sanchalan is neck movement up and down. So for that, again, sit straight. If you want, you can close your eyes so that you can, mental focus should come on the neck area and the sensation which is happening there. So inhale, slowly exhale, chin to your chest. Inhale, go up as much as your head allows, and exhale down. Inhale, exhale, inhale, and exhale. Return to neutral pose position. So 3 rounds of each Griva Sanchalan we are going to do. This was the first one. The second is lateral movement of your head. So for that, again, make sure your shoulders are stiff. You are not going to move your shoulder, only head movement, and the stretch, mental focus has to be the stretch which is happening at the lateral side of your neck. So inhale, with an exhale, slowly head down, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, and exhale. Inhaling, come up, relax. That was Griva Sanchalan number 2. Now the third, we are going to do half circle. So again, inhale, with an exhale, look towards your right. If you want, you can close your eyes. Inhaling, come to center, only neck movement. Exhaling, other side. Inhale, center. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale and relax. Mental focus, keep it on your neck. Now we are going to do complete circle. So for that, again, inhalation and exhalation along with the movement is very, very important. So take a deep inhale and exhaling, head down. Now inhaling, make half circle. After you reach back side, exhale, half circle and come down. 3 rounds each side. Inhaling and slowly exhale, come back. Third round along with breath. Now change the direction. Inhaling, go back. Exhaling. Second round. Now inhaling, come up, relax. Open your eyes. That was Griva Sanchalan, 4 rounds of 4 different kinds of Griva Sanchalan. Excellent for central vertigo. Next, we are going to do our eye exercise, which is a very simple version of Jatatrataka. How to do? Keep your hand shoulder level, your thumb, look at your thumbnail. Focus your eyes there. Now, keeping your gaze at that part, move your head up and head down. Don't shift your gaze. 3 times. Come back to neutral. Now, lateral movement of our head. So for that, your gaze has to be on your thumbnail. 3 times. Come back to neutral and slowly your thumb down and you can do palming. Rub your palms, make it hot, keep it over your eyes. Now we are going to start our asana practice. The first we have to do Marjorie asana. For that, this is good for warming up your spine. So keep your hands on your knees. Inhale, arch your back, and exhaling, curl your back. Inhale, lengthen your spine. Exhale, curl your spine, head down. 3 rounds. Last round. Inhale. And exhale. Inhaling, come to center, relax. Next asana is Vajrasana. For that, open up your legs. Inhale, with an exhale, right leg fold. Again inhale, with an exhale, your left leg fold. Let me turn this side. This is Vajrasana. Your hands in Chin Mudra, first finger and thumb joint. Stay here, your back straight, normal breath. 3 rounds of relaxed breathing. Good for your spine and good for your mind. After 3 rounds of breathing, open your eyes, interlock your hands. We are going to do Urdhva Vajrasana. So inhaling, both the hands up, pull it maximum till you feel stretch at the lower back. Now look up. Your whole spine from lumbar till your cervical is active now. Look at your small finger. 3 rounds of normal breath. Slowly exhaling, both the hands down and relax. 2 breaths of relaxation. Next asana is Shashankasana, and after that we are going to do Balasana. They are similar with just a little deviation in hand movement. So how to do? First Shashankasana. So inhale, exhaling both the hands back. With your right hand, hold the left hand's wrist. Pull your hand maximum down to open up your shoulders. It will relax the shoulder. Now inhale, with an exhale, keep looking forward, keep lengthening your spine. Exhaling, gradually go down. And after your chest touches your thighs, head down. 3 breaths. This is Shashankasana. Now from here we are going to do Balasana. So release your hand, take it forward, take it all the way to the front. Try to put your elbows down, relax your shoulders. This becomes Balasana. Three normal breaths. Relax. It promotes the movement of blood towards your head and neck. After 3 rounds of breathing, inhaling, pull your hands towards yourself and slowly raise your upper body. And come back to Vajrasana. Suppose if your head is not touching the ground, you can use cushion also, and you can stay here for Balasana or Shashankasana. Our next practice is Paschimottanasana. So for that, open up your legs, both the legs forward, toes towards yourself, keep your whole leg tight, your body in complete 90-degree, stomach tucked inside. Toes towards yourself, make it tight, be aware of your posture. This is Dandasana. Now inhale, take both the hands up, exhaling, go for Paschimottanasana. Again the same way, lengthen your spine first and then try to go down. If you want, you can keep 1 or 2 cushions so that your head can rest nicely and stay here for 3 breaths. Slowly, if you want, you can remove it. After 3 breaths, inhaling, come up, exhaling, both the hands down and hands backside, relax. 2 breaths of relaxation. After this, we are going to do a standing posture, which is very good for balance. So for that, let's stand up. Take the support of some furniture or wall and then stand on one leg. Other leg goes up. Stay here. After 2 breaths, if you want, you can go for Ardha Padmasana. So for that, use your left hand to hold the feet. Stay here. If you want, you can raise your left hand and you can close your eyes for extra intensity. See if your body can take it. If you feel any kind of dizziness, you can open your eyes and start looking at one fixed point at the wall. After 3 rounds of breath, leg down and change side. So now we have to stand on other leg and first start with this paw pose. 2 breaths here. You are signaling your body for balance, signaling your mind for balance. After 2 breaths, using your hand, come for Ardha Padmasana. Raise your hand. First keep your eyes open. If you want, you can close your eyes and test your body, but don't remove the support. 3 rounds of normal breath. Feel how your body is balanced on one leg. After 3 breaths, hand down, using your hand, leg down and relax. That was our standing balancing pose. Now we are going to do Vipreet Karni, of course with the support, because vertigo patients, they have to do all the practices with some support. So for that, sit adjacent to some wall or heavy furniture like that, parallel. Now using your hand on the mat, try to raise your leg. Make sure your hip is touching the wall or heavy furniture, some gap between your feet, shoulders down. Stay here for 5 breaths. You can stay for 10 minutes, 15 minutes also, because this is a great relaxing pose and it promotes the reverse blood flow towards your head and neck area, giving you a lot of relief. After 5 rounds of breathing, same way you have to come. So turn, and then from here we are going straight to Makarasana. So for that, come in prone pose. Now using your elbow on the mat, raise your upper body and with your palms make a cup shape and rest your chin here. Stay here. Push your pelvis towards the mat and feel your lower back. Again, a great relaxing pose. Plus, it arches your cervical spine too. So good for central vertigo. If you want, you can raise your chin further. After 3 rounds of breathing, gently come down and relax. If you want, you can turn this side. Lie down on the mat and do at least 5 minutes of savasana, that is relaxing your body parts one by one from the toes till your head. I am not going to do here. Now I will go straight to for pranayama practice. So for that, right side turn and get up. Now pranayama, for that sit straight, spine straight. We are going to do 3 kinds of pranayama. First is clavicular breathing, second is anulom vilom, and the third is bhramari pranayama. So first clavicular breathing. So for that, your hands resting on your knees, close your eyes so that you can feel the breath. Inhaling, raise your shoulders maximum up, and while exhaling, exhale from your mouth. Okay, so 3 rounds of clavicular breathing like that. So inhale, exhalation should be longer than inhalation. After 3 rounds, relax. So apart from relaxing your shoulders and neck area, clavicular breathing also helps in, especially when you exhale slowly. If your exhalation is double than your inhalation time, then your upper respiratory tract also gets clean and you feel a lot of calmness in your mind. Next is, as I told before, Anulom Vilom Pranayam or Nadi Shodhan Pranayam, which is great for balancing your left and right brain, your left and right side of the body. It's a great balancing pranayam. So let's start that. Left hand chin mudra on your left knee, right hand nasikagra mudra, which is first 2 fingers folded. Use your right thumb to close your right nostril. First inhale from both the nostril and then closing your right nostril, exhale completely from your left. Now inhale from left, close left using your ring finger. Open your right nostril, exhale completely from right. Again inhale from right, close right, exhale completely from left. Again, this was 1 round. Again, if you can double your exhalation time, then it's very good for you. 1 round I did, 2 more rounds I will do silently. After completing your 3 rounds, and down and relax. Feel your mind. Our last pranayam is Bhramri pranayam, which is simple Bhramri. Inhale from nose, and while exhaling, you have to make a sound like female honeybee, and you have to close your ear also with this finger, ear flap, to cut up all the outside sound. So inhale from nose. After 3 rounds, your hand down. I did only 3 rounds of Bhramri. If you want, you can do 10, 20 also. After completing your pranayam practice, rub your palms nicely, make it really warm, keep it over your eyes. Energize your eyes. Again do palming, generate some heat energy, apply it to your ears. Feel the heat from your palm radiating into your ears. Again, rub your palms nicely, make it really hot, and back of the head, just above your neck area, the cerebellum part, energize that part, which will give you a lot of relief from central vertigo. Now with a smiling face, you can open your eyes. Now some tips. So the first tip is, when you are having an acute episode of vertigo, don't try to move, don't do any jerky movement. If possible, sit at one place, don't walk around because you may fall. And no bright light, no phone, no reading that time. Try to talk less during that time. Let that episode pass. A disciplined lifestyle is the key. Getting up, sleeping, and your food intake should have a fixed time. Good night sleep is very, very important. Good posture is very, very important, because the bad posture strains your neck, makes your blood circulation sluggish, which can affect your vertigo, or it can worsen your vertigo. Good hydration is also very, very important. No strong flavors in terms of food for you, like no pickles, no oily, no sugary food. Simple home cooked food is the best. Manage your stress wisely, either through meditation or through some chanting or through some prayers, because during stress we make our body tight, we make our muscles tight, which reduces the blood flow towards the head area. It worsens your vertigo. That's all, and thank you, and do take care of yourself.